Evening, everyone. Hopefully everything is now working correctly. Okay, it is telling me that there is at least one other person watching, so hopefully welcome, whoever you are. If you do want to say hello in the chat, please do so. Also, if anybody that's on here, either jumping on now live or on the replay, if you can like this, and then it will promote all my YouTube out to a wider audience. I'm just going to go through sort of the reasons why I haven't been here for the last sort of nearly 12 months, and just a general update, and then answer any questions that anybody has got in the chat. Things on StreamYard have altered since the last time I was on. It seems to not allow me to do my disclaimer, so I am going to just put the disclaimer on as a banner at the bottom. So any of the information that I do provide today is only for educational and entertainment purposes only. I am not your healthcare professional, so please make sure you do talk to your own individual healthcare professionals if you do have any issues. Let's go. Hi, Tanya. Great to see you online. Yes, I am a bit of a stranger. It has been a long time since I've done a video, done a live stream. Things in life got a little bit hectic, and then I was ill, and I just realised when I undid, I'm hopefully going to put the better microphone in there. Been a long time since I've done a video. So yeah, so last time I did a video on a live stream was like last September, and since then I did spend 6 months helping out family with diagnosis and health issues. I then got very stressed at work because I did doing extra hours at work because I got promoted and into a new position. So I've been doing that as well. And with all the stress that's going on with my family, with work, I ended up getting shingles a couple of months ago, which really did knock me to six. So yeah, just crazy stress and such like. Obviously, shingles is triggered by stress, so I did think I would just mention about what shingles is and what problems it can cause. So shingles and chickenpox are related, as in that they are from the same virus. Most people, especially here in the UK, most people quite often get chickenpox as a child. We don't generally use the chickenpox vaccine in the UK. I know it is used in various other countries around the world, but in the UK, the chickenpox vaccine hasn't tended to be part of the schedule. However, it is going to be start of the baby schedule as from January 26th going forward. So in the future, children may be getting the chickenpox vaccine. But yeah, in this country, the majority of kids just get chickenpox when they were children. I think I was about 7 or 8 when I got chickenpox. Both me and my brother got it at the same time. I had fairly big spots. My brother got spots everywhere, really intense. So chickenpox usually only ever get once in your life unless you've got immunocompromised or other issues. You just get the chickenpox, and then it lays dormant. And the chickenpox virus hides in your body. It hides in the nerves in your body. And then later in life, under times of physical, emotional, mental stress, the virus can explode back out and erupt, and it quite often does that along a nerve line. So the virus goes along a nerve. So it's usually on one side of the body on a nerve, which can be the nerves across sort of your back, or your front of your body, or it can be on one side of your face, as it was with me. And the thing with the virus is it's not just the spots. People always think, oh, it's just some spots. It is not just the spots. It is virus that's hitting you when you're already stressed, and it's hitting your immune system, and it does knock you for six. Literally, I started on the Wednesday. I was starting with a headache, and I just sort of, I was at work at lunchtime, and I just um, said to my line manager, I'm just like, I'm not coping. I'm getting this headache. I'm going to have to go home. And I would also said to my friend, I went, oh, I think I'm getting some zits on my forehead. Oh, I've not had zits for ages because I'm not somebody to suffer with spots. And then the next day, I just couldn't get rid of the headache. Thursday and Friday, I struggled through with the headache. Also, thing. And then by the Friday evening, I'm like, right, these spots are getting tender, and the whole of my scalp's tender. It was all across my thing, the scalp, and it was also going into my eye and across my eyelid. And then I suddenly tweaked. I went, this headache, these zits, that's shingles. Um, yeah. So yeah, I'm just reading your comments, Tanya. Yeah, yeah. Shingles is not a joke. It's not. Yeah. So well, I've not been through labour, but I can definitely say it was not pleasant at all. I was very, very lucky because I knew what it was within sort of the first 2 days, and I also know what the system is in the UK. I don't know whether you are in the UK, Tanya. But I knew in the system in the UK, it has recently this last year, community pharmacies are now able to diagnose and give out medicines for 7 common illnesses, one of which is shingles. So on the Saturday morning, I woke up on the Saturday morning, I phoned 111, and obviously I knew what I was wanting. And I said to her, I said, I'm pretty sure I'm getting shingles on my face. I know a community pharmacy can give them. Can you go through all the details with me and find me which is my local community pharmacy that has a pharmacist that's capable of doing this? And the woman on that 111 was brilliant. She obviously went through all the coding that she has to do on the system, checked that I wasn't dying of something, didn't need to go to A&E. And then she went through and she said, yes, it does sound like it's simple shingles, so I can refer you to the community pharmacy. I went down to the local community pharmacy who had already had all the information through 111 onto his computer system. He sat me down, went through the consultation. Luckily, I said I was pharmacist. He said he had actually had shingles during COVID. We had a great discussion, went through it all, and he was able to supply me the 7 days of acyclovir, which is 5 tablets a day, 800 milligrams for 7 days. And I could get first days, all 5 of the dosages in that first day. So I was straight on getting it. But I have to say, I slept the whole of that week. And it has taken me a long time to carry on from then. Uh, um, yeah, right. Keeps buffering on my end. I don't know how bad that is for other people. Um, right, I don't know what Valtrex is. I'm assuming that might be a cyclovir or similar, one of the antivirals. Um, yeah, yeah, but yeah, the chickenpox vaccine. Yeah, it is coming for the UK from January 26th for the shingles vaccine. So there is a shingles vaccine for people who have had chickenpox and to help prevent them getting shingles. And in the UK, for a long time, it has been for about the past 10 years, everybody as they turn 70, or if they hadn't have had it when they were turned 70 and they're turning 79, was the catch up. They were giving everybody above the age as they hit 70 and as they hit 79, the vaccine. They've now changed it to also include those above 65. So for the next 5 years, those as they hit 70 will be getting it, and those as they hit 65. Once that 5 years is up, it'll then be everybody getting it as from 65. Also, people that from the age of 50 who are immunocompromised are able to get the shingles vaccine as well. Hello, Angel of Glass. Yeah, I've missed coming on here and seeing you all. Yeah, I have really missed doing these live streams, but I'm going to start getting back to them. Obviously, this is just an impromptu one. I've only just advertised it, so I'm just hoping that it gets shown on Instagram, on YouTube, get some of my usual subscribers back on, knowing I'm around asking questions. So for anybody on the replay pro, if you can fill up the comment section with any things that you would like me to either do in a future live stream, or if there's any actual videos as one-offs that you would like me to do. I know there's lots of information going around at the moment. Obviously, the big ones in the press are things like the tirzepatide Mounjaro for type 2 diabetes and for weight loss. There's also talk about so the tirzepatide Mounjaro is the dual agent following on from the semaglutide Wegovy single agent GLP-1s. There is talk that next year there'll be a triple agent coming out on the market. There's also talk of an oral agent coming out on the market. So with that, you can see that all the other wellness companies are also trying to fetch out their non-pharma supplements to try and also help with weight loss. But I do think it opens up a bigger conversation of the fact that it shouldn't just be about treating with a supplement, treating with a medication. It should always be a full-on package of care. In the UK, there is the guidelines that tirzepatide should now be available for prescribing. Unfortunately, the NICE guidance say that it has to be alongside a wraparound care service with lifestyle, diet and exercise advice at the same time. And unfortunately, most local areas don't have that sort of support system in place to provide that. So it's still not getting prescribed because there isn't that wraparound service. Because yes, these agents are great. They do cause a decent amount of weight loss. Its main mechanism of action is on regulating the signals between the stomach and the brain, and the hormones that are released once you've eaten that tell your body how to regulate. So your insulin does affect the insulin, not directly, but through the GLP-1 pathway. But unfortunately, a lot of people on taking it reduces the amount that they can eat, reducing the calorie input. But if you're not also ensuring that your diet is perfect alongside having that reduced appetite, you can end up then having deficiencies because you're not getting enough nutrients into your system, your vitamins and your minerals. Also, if you're not taking in enough protein, one thing that they found is that if you're not doing strength exercise and keeping your protein levels high, you're going to be losing just as much muscle mass as you are fat. Your body's going to decondition, and one of the best things that you can actually do for your body is to keep your muscle mass. Yeah, I can see both Tanya and Angel saying hello to each other in the stream. Yeah, thanks for sharing. Hopefully, I can let people know that I'm back up and running. I have to say, one supplement that I have been doing. So, I have been trying to look after my health. Prior to this last year, I had been doing really well, going swimming and going to the gym. But with life getting in the way, my extra hours at work, looking after family, that got put on the back burner. And then being ill, again, I've only just been getting back up. But this week I did go swimming on Friday evening. I like going to the ladies only session, and I have just been to the gym this afternoon. So one thing I'm really trying to concentrate is on strength training. With me having the Ellis hypermobile Ehlers-Danlos syndrome and my joints being unstable and the pain that I get from that, one thing I really need to do is keep up the strength training. And one thing I was noticing was I was getting struggling, standing up without using my arms. And I'm like, I need to keep my independence and mobility for as long as possible. I saw my granny go lose her mobility. My mum's mobility is not the best at the moment, and I want to make sure that I can keep my mobility so that I can look after all of my family. So I'm really concentrating on the strength training. And the one supplement I have researched that can really help with helping your muscles condition quicker, recover quicker is creatine. So I have started taking creatine, and I just add 2 grams of the creatine monohydrate to my water bottle when I go swimming and when I go to the gym, and it seems to be working. A couple of things to note is because of the way that it goes into your muscles and it helps your muscles pull in fluid and work. Um, it can look on the scales as though you gain a couple of pounds once you start taking um, like, creatine, but it's only water weight. It's not that you're gaining any fat. Um, so, and the other thing to notice is if you are going to be doing blood tests, creatine does break down to creatinine in your blood, so and then gets excreted through your kidneys. So it can slightly raise that, which then could look like you've got some kidney function issues, but it's not. It's just a false elevation, and so it's worth either stopping the creatine for the week before the blood test and letting your GP know. Okay, yeah. Angel, you say you have POTS. Yes, I think I've got undiagnosed POTS. I've discussed this with my GP. I've got diagnosed sinus tachycardia that's been diagnosed as high heart rate. I do have the old-fashioned test of sit down, stand up, checking your pulse rate. It does jump straight up to over 120 on standing. So I passed that test, but I'm not going for the tilt table test while I can get away with it. I already take propranolol anyway because of um, prophylaxis for migraines and treatment of essential tremor, and so it helps regulate my heartbeat. And if I was to go for the true POTS tilt table test, I would need to stop the propranolol, and it just helps me so much with other things. I just don't want to go through that washout period, have the whole hassle of the referral. So while I can keep it under control with the propranolol, with ensuring I'm hydrated, with ensuring I'm balanced with my exercise, I'm not actually going through that process. Yeah, that's the other thing. The tilt table test, a lot of people will pass out on it. I know for well, I'll probably pass out of it. A lot of people on it would probably throw up. I do have metaphobia. There is no way I want to do anything that is going to make me throw up. So, yeah. So, I don't want to go on there to prove that I am going to faint on it. It's not necessary. But yeah, I would encourage anybody who is not actually getting the help and support that they need to push to go and get the test. Okay. Looks like it's just the three of us at the moment. I did know that Mr. Angelab had said hello in one of the comments, so I'm assuming he's either saw that I had technical difficulties or will be on watching later. And I know a few other people said that they would. So this was just going to be a quick hello live stream. Unless either of you have got any particular burning questions, And then I'm just going to get the feedback in the comment section of, would you like me to start these back up again every 2 or 3 weeks? And do you have any suggestions for particular live streams? So thank you both for coming. Sorry that it's been short and sweet, but if there is questions, I can plan like I've done previously when I have planned out and done a whole update on the migraines, or I've done updates on I've done updates. I can do updates on diabetes. I can do updates on peptides. It's quite a lot of different things going on. New agents coming on the market. There's a new agent that's come on the market for GPs to prescribe for sleeping, which I'm not that convinced about, and it could end up being used in the wrong people. One of the questions that I'm always getting at work is questions about melatonin, especially in the UK. So in the US, it can be bought over the counter, but in the UK, to get melatonin for your children, you have to get a referral to a paediatrician or a local CAM service, and then it's passed back shared care, and there's so many hassles of getting that shared care sorted. We also have a whole load of hassle of getting, even though the stock supplies are back for ADHD medication, there's still a whole load of problems of people getting their shared care for that with their GP, especially if they got referred to a private provider on the NHS, because that causes a lot of confusions. So there's so many things that are going, and then the government are wanting to have the amount of people that are employed by ICBs, saying that we're not frontline staff, forgetting the amount of support that my team actually provide for frontline staff. I spend a lot of my days with GPs and nurses and admin staff in practices asking me, what's this new medication? This is how do we prescribe it? This is out of stock. What's an alternative? We've just done. My team have just swapped a whole hundred of, I think it was about 200 to 300 patients who were on the Freestyle Libre sensor. Well, the Freestyle Libre sensor, the Freestyle Libre sensor 2 is being discontinued, and it's now the Freestyle Libre 2 Plus is replacing it. So we had to actually change the prescriptions and change how the prescriptions were written from the 2 to the 2 Plus, so that everybody could get it swapped over, as well as writing a letter out to the patients. We didn't actually send it by letter. We had a letter and we tagged it into a text message so that the patient could either read the text message, see the letter, or ask for the letter. But send all that information out. And with us doing that, it saves the GP practice having to do that. And so we are actually saving the frontline a job to do, which obviously they'd have to do. But the government don't actually understand all the different parts of the NHS and what we are doing with the supposed streamlining. So no, the Libras and the Dexcoms, you don't have to. These are for people who are getting it on the NHS for free. So the people with type 2 diabetes, a certain subsection of patients who need to do blood testing, so they're on either insulin or medications that are causing a hypo. If they're needing to test more than about 6 or 7 times a day, then on the NHS they can get the Freestyle Libre on the NHS. Now, when it comes to type 1s on the NHS, most of those are usually on the Dexcom. And again, they get it for free, so it'll be on their prescription. But we also are with people, we have now got a 5-year plan for everybody on type 1 on the NHS to be given the hybrid closed loop system, where they have the Dexcom CGM, the insulin pump, and the device to go with it that actually acts as an automatic pancreas, checking blood levels to insulin levels. So, so the Dexcom, the Dexcom is usually more used for people with insulin and type 1 diabetes, um, for the UK, and the Libra is mainly used for the type 2s. But there is some overlap on different subjects of people. Um, but yeah, so but yeah, if you reach the NHS criteria, you'll get it on free on prescription. Obviously, yes, they are being sold online and from pharmacies for anybody to buy, but they are like over £100. So I don't see many people that will be buying it. Well, some people do buy it, but unless you're diabetic, you don't really need to. Yeah, the Dexcom can be really great. I just think the main thing to remember with the Dexcom and with the Libras and all the devices is that they're not blood glucose measuring, they are interstitial fluid glucose. So they will always be half an hour behind. And once you've got your head around the fact that they always will be half an hour behind because they're measuring the interstitial um, fluid, then you can make adjustments around that. So it's knowing the fact if you are going to have a high carb meal, it could be you could be running high for half an hour before the sensor lets you know that. Also, the reverse is true. If you've injected insulin and are going hypo, you might not necessarily know for a delayed half an hour. And the other one for people who do a lot of exercising, if you were to be going and doing a major aerobic exercise for half an hour or an hour, again, you could be going hypo before the sensor's letting you know. Medatronic. Oh, hi, Tori. Yeah, I've just been talking, nothing exciting happening. I've just been updating people and generally having a bit of a, you know, just waffling on different things. So, but yeah, it's great to see that I've still got a few people here that are willing to support my channel. And hopefully, if I can get back up and running, let me know. In the Oh, is it your insulin pump? Ah, yes. I'm not exactly sure with the names of all the insulin pumps. All I know is that we're highlighting the set of patients and them getting off. And the other thing I'm reminding um, practices, the GP practices on their prescribing is when somebody's on the pump, they will have the insulin vials for filling the pump, but they must still have access to the pens and cartridges for backup. Because if the pump fails, there needs to be a backup, and the patient still need to be fully trained on the backup of using the pens and measuring that way in case anything does actually happen with the pump. Yeah, but yeah, the pumps have been amazing for people, especially for children. Um, Definitely so much better than previously, and the CGM devices as well. Historically, the amount of people that might have been having hypos overnight, their sugars might have been running high so often, and they've ended up with that end stage kidney damage, eye damage, fingers, toes, even sort of full legs. And with getting these insulin pumps and these CGMs, we can be getting so much better control. So kids that are getting diagnosed with type 1 now will be able to put off a lot of the long-term effects of diabetes well into their older years, so reducing those complications, which again will then reduce the burden on their health. Got to try it. It's not just about keeping people alive longer; it's about keeping people well and healthy for longer as well. Yeah, yeah. I'm glad you've got your pens and your regular insulin as well. Oh, hi, Dami. Yeah, Um, you're not really that late. I was 10 minutes late logging on because my computer decided to do a reboot and upgrade. just at 6 o'clock. Yeah, but yeah, if you wanted to go back and just watch from the beginning, if you want, I would watch back on double speed because I have just been waffling. But yeah, great to see everybody. And yeah, it won't be as long next time. Now we're getting into September. My daughter will be turning 19 very soon, and she's just started a job, so things settled down with that. She's now finished college and got a job. So she's independent. She doesn't need mummy anymore. Though I get told off when I call myself mummy. Um, it's like, yeah, mum. But yeah, she doesn't really need me anymore, other than to just be my tenant now in my house. Um, so yeah, hopefully things have settled down at work, and hopefully things for my family have settled down a bit. And oh, it's not until October, and unfortunately, August, September, October is a bit of a nightmare birthday wise. Starting last weekend, my three nieces, my mum and my dad, and my daughter all have birthdays within a 2 month period. So, yeah, it's a bit crazy. Yeah. Yeah, they do, even though when they're as a teenager, they say they don't, but then, yes, you get into your 30s and 40s, and then you want your mummy all the time. So, yeah, I still need my mummy. Yeah. So, thank you, everybody, and I'll sign off now and hopefully chat to you all again soon.